Open Hearth to care for this community. When we first arrived, we had 10 positive tests. Right over the subsequent 14 testing experiences, we had 1 positive test. Together, we were able to maintain and restore the health of this community. Over the course of this pandemic, Hartford HealthCare has gone into the community more than 1,500 times with mobile testing units. We've partnered with churches. We've been in prisons. We've worked with community centers. We've worked with community leaders. We've worked with our political leadership across all of the cities in the state of Connecticut. And we've learned a great deal about how to align our capabilities with community leaders, people who are trusted, so that we can deliver our services to support people during this pandemic. Today's a moment where we take all those learnings throughout this pandemic and we're going to apply it perhaps to the moment that matters most, which is how we can deliver this vaccine to our communities. And we know with health disparities, we know we have seen the rates of people who test positive. And we know that people within our inner cities who are living in congregate settings, who are in different communities, have been testing at a much higher rate. And the work we can do by delivering our vaccine, by partnering with different people and organizations, we're going to take this head on. We're committing today to have no community left behind. We're going to use the resources we have within Hartford HealthCare to bring testing into the community. This is the first of many. This is the first of many. We'll be using mobile testing. We'll be using drive-through testing. We're going to be setting up pop-up centers across Connecticut, doing it in partnership with various community organizations and community leaders, bringing the vaccine to where people are, where people have trusting relationships. We're going to be bringing our experts, our leaders within Hartford HealthCare, you're going to hear from some of them today, into the community so that they can build trust, so that they can create confidence, and so that we can deliver this vaccine to all of the populations. Again, no community will be left behind. We also will be developing 5 pop-up centers across the state of Connecticut. Developing vaccine centers. We're going to be delivering the vaccine wherever and however we can. We'll be extending hours. We'll be extending days of service. The only rate-limiting factor will be the number of vaccines that are available to us. The partnership we've had with the governor, the partnership we've had with the speaker, Matt Ritter, who you'll hear from today, has been tremendous. The responsiveness of our state leadership has been terrific. And to the extent with the Biden administration that more vaccine comes into Connecticut, we're going to be built to deliver it. We're going to do it as safely and as efficiently as possible. And most importantly, we're going to be doing it in the community. And we're going to make sure that no community is left behind. So it's a tremendous honor today to be here. Now, this center, the Open Hearth, it was founded approximately the same year as the Hartford Hospital, more than 166 some odd years ago. We've been in this community together continuously, always addressing the moments that matter most. And when we came here in April and we developed this first testing capability, which ultimately proved to be essential in how we fought COVID-19, we started here at the Open Hearth. And today, where we also now, the dawn of a new day, we start with bringing vaccination into the community, we start with the Open Hearth. So it's my pleasure to bring forth Marilyn Rossetti, who is an amazing person, an incredible human being, a tremendous partner to us within Hartford HealthCare. Her mission, the work that she does, inspiring is not strong enough a word to describe the difference she makes in our community every day. We're honored, Marilyn, to be here with you today. Thank you so much.
Thank you, Jeff. Thank you, Hartford HealthCare. I want to start with a story. Last night I was thinking about what I really wanted to focus on, and a former employee who had been a client at one time said to me once that the Open Hearth is where miracles happen. And this is what's happening today, a miracle. But it's not surprising, because Hartford HealthCare is our neighbor. And as Jeff said, we've been together through this journey, 160 plus years. Not me personally, even though over this last year it does feel like that. And I'm sure it does for a lot of you. But we're neighbors, and this is what neighbors do. But something else that we need to talk about is the work that we do. We house men experiencing homelessness. We have 100 men here. We're down from 130 for safety reasons, but we're often a community that's overlooked. People try not to see for a lot of different reasons, but we bring hope here. We do the work. And testing, which we started with Hartford HealthCare, allowed us to do the work. Men could get back with their families, men could get employment, men could move into housing. And this is what vaccines will do. It will take us to the next level. I said to many people here, staff and clients, this is something that millions of people are trying to get, and we're getting it. We're getting it first. I said, and it's not something that's being done to us. It's something that's being done for us. And we couldn't be more glad. Are there nerves? Are there, excitement? Certainly, but today is a new dawn, and it is where miracles happen. So I can't tell you what it means to us. I just can't. But what I can do is introduce someone who can also, I don't want to use the word extrapolate, who am I? Who can continue on my conversation. I want to introduce David Knighton. And David was here when I became the executive director 10 years ago. And David will tell you his story. David was a former client. David started out in a job here, and David is now a supervisor. And I'd like to think that's how all men can progress who come through the open hearth. David is what you'd like to think an employee should be. David is like what you'd like to think the success story of the open hearth. So it's my pleasure to introduce David Knighton. Please come up.
Hello. Oh man, I'm nervous, but that's normal. First of all, I'd like to thank Hartford HealthCare for giving us the golden ticket, just like the Willy Wonka chocolate factory movie. This is a golden ticket, and I'm just glad that y'all offered it, extended it to me and my family, because I give my family a peace, knowing that I work in a place like this. I'm able to go home today with a lot of touching today, but I don't know what really to say, but I'm grateful, and I know the men at the Open Heart is grateful for this opportunity that y'all have given us with. Like I said, this is the golden ticket, and we didn't want to pass up on it, and we appreciate that. Like she said, I'm a former client, now I'm a supervisor, but it was, it was rough last couple months here, but we managed to maintain and keep going, and we're looking for a little bit of normalcy now with this vaccine, and I just thank everyone.
David, thank you. We're going to give you the golden ticket today. This is, what we're doing today is we're giving people hope. We're giving the men of Open Hearth hope. And we're going to help return people to normal. In so many ways in healthcare, we don't want to go back to normal because we're going to be better than normal. And this is one of those great examples on how we're going to be better than normal. We've learned a lot in this pandemic, and amongst the most important learnings is there's great disparities in healthcare. They have to be addressed. We have to figure out new and creative ways to do it. We have to use our resources differently. This is what we're doing. That's what we're doing today. And we're giving these men of Open Hearth hope, and we're developing and learning, and we're going to be better than normal. I want to invite, and it's a great pleasure to do so, the Speaker of the House for the state of Connecticut, Matt Ritter, is an incredible advocate for the state of Connecticut, and certainly for his hometown of the city of Hartford. And I can tell you, in my capacity, he provides guidance, support, he's accessible, he's a tremendous, his passion, his interest. This is someone who literally works 24 hours a day for his constituents. and someone who cares so deeply about the state of Connecticut. And we look at how we're ranking today with our response to the pandemic and specifically how we're administering the vaccine. We're amongst the first few in the country, the very top performing states. And it's because of leaders like the Speaker of the House, Matt Ritter. Matt, please.
I follow protocols. I'm very good at that. Well, thank you, Jeff, and I'll be very brief. I know it's a little chilly out here, but your remarks mean a lot to me. Now, David, I loved your words, but I got a bone to pick with you. A cowboy hat? I'm gonna get a New York Giant hat, and I'll be by soon, okay? You know, Marilyn, you gotta screen a little better when you bring people in front of the media. Congratulations, Marilyn, and that's the wrong word, right? But it is a day of hope, and it's a tremendous day, and this is gonna keep happening in Connecticut. It's going to keep happening in Hartford. We're going to continue to get better. And people say to me, well, how do you know things are going to get better? And I say, because of folks like Hartford HealthCare. Last spring, when we had a lack of testing in Hartford, Senator McCrory and I were getting the phone calls, you might imagine. The first call I made was to Jeff. Within 2 weeks, we had a massive pop-up center in North Hartford, and they just kept growing. That's the kind of commitment that Hartford HealthCare provides to our city. So does it come as a surprise to me they're here today? No. And will it surprise me next week when they're doing another setting? No. So to the doctors and the nurses and the professionals that are making this happen on behalf of our wonderful city, we appreciate it. And I know things are going to get better with your expertise. And we're going to do better as a country and better as a state. So thanks for having me today. It's a great day. Go get vaccinated. Thank you.
Just several weeks ago, we celebrated what we called the dawn of a new day. And the first person who rolled up his sleeve to be vaccinated in the state of Connecticut, amongst first people, is Keith Grant, who is a leader of infectious diseases across all of Hartford HealthCare. And Keith has played a vital role fighting this pandemic on the front lines, but most recently on the state advisory council on the vaccine, and helping us lead the efforts in Hartford HealthCare and how we're distributing it. I'd like to invite Keith Grant forward, please.
You know, it's always weird going in the lineup, you know, with Jeff's word and everyone else. It's very difficult to follow up, especially from my perspective, from an epidemiology perspective. A lot of what I have to say is where the numbers are, so to speak, right now, right? However, I'm going to shift just a little bit. So last night we had a discussion as a team, as a leadership team, and we were fortunate to be a part of a group to discuss where the state is from a health disparity perspective, and observing what this disease has done in certain communities. And at that moment, I think we had, we're always focused on how we get to every single community in the state of Connecticut, not because this is something we need to be congratulated about, but because it is our duty. This is what Hartford HealthCare is supposed to be doing. This is our impact within the state, and this is something that we hold very dearly. The conversation last night was around how can we do more? Like, how can we reach more and have more community presence, specifically with the vaccine? How can we extend our expertise to deliver the message and deliver the communication and education that's needed to probably reduce the hesitancy, increase the knowledge within the community, increase the advocacy for the vaccine within the community, the advocacy for what's needed to reduce the spread across not just the state, not just Hartford, but across the country. So, I will echo what everyone has said before. This is the first of many of these. Our intent is to communicate and collaborate with every single entity within the community that's going to give us the biggest yield, that's going to address the communities that we believe and we know are most impacted on this. The other thing that Jeff says that I really want to go back to is the fact that when we look at the health disparities that existed, that definitely contributed to the disparities in the mortality rate, we do have a significant opportunity. What this disease showed is that we were doing very good, but we could have done better, and we need to do better, right? So this is not just about COVID. These partnerships shouldn't stop after COVID is gone. This is a commitment from Hartford HealthCare, and this is a partnership that, as I said, will extend partnerships. But this needs to be long after COVID. And I will say one of the things too is it's two ways. So please reach out to us. If you believe that there's something we can do more, if you believe that there's communities that we need to get to faster, possibly, definitely reach out to myself and members of the leadership team, and that's something we'll do. Thank you so much.
Thank you, Keith. You know, we've been here at the Open Hearth from the beginning. We've been here always. And we were here from the beginning of the pandemic. We were here when we first did testing. We were here throughout this entire last 9 to 10 months. We're going to be here in this moment delivering the vaccine. Today's a shot of hope. And we're going to be here in the future, always together. Thank you, and we're happy to answer any questions we can.
I had a question. The challenge at the beginning was really the access and distribution, and that seems to have ramped up a lot. The city of Hartford announced yesterday they're plan to do vaccines at the stadium. But there's a shortage of vaccines, so what is your message to the federal government and the new administration about getting vaccines to states so they can give them out?
We're hopeful. We're hopeful with now President Biden making a strong commitment yesterday, signing new executive orders, trying to use all the capabilities, hopefully at the federal level, to bring vaccine to the community, that it will result in having more vaccine. What I think is important to note in our state, because of the collaboration that we have, because of the coordination we have across all the health systems in the state of Connecticut, we're built here in Connecticut to deliver the vaccine. And I'm comfortable as the vaccine does arrive, we will collectively, as a community, be very well situated in delivering it.
And Jeff, after we have some people watching through Facebook right now, so after all this pomp and circumstance, everything gets taken down. What's actually happening? Is there something happening today, and how many vaccines and that kind of thing?
Yeah, we're going to be delivering 136 vaccines here today at the Open Hearth, and it's going to be happening near immediately. So there's a process, and if you'd like, I'm going to ask Dr. Jim Carton to come forward. Dr. Carton heads up our overall both testing and vaccine operations. And Dr. Carton, if you would explain the way we're going to do this, actually how we do it.
Good morning, everybody. So the process is somewhat different than testing. We've learned a lot from testing, but it needs to be much more coordinated and controlled. So every person who comes through the vaccine has an appointment. That way we eliminate the people queuing up and the potential risk that has. It allows us to keep a consistent process of moving through. We have all their information. There's an easy check-in process. That allows us to then move through that in minutes. They get their vaccine, and then we need to observe them for 15 minutes afterward to ensure that they're safe and have no adverse reactions. That process is all controlled and timed. We then have every person who gets a vaccine scheduled for their follow-up vaccine, depending on which brand they have. We schedule that appropriately so that as they leave the clinic, they have their follow-up appointment to get their second dose. All of this is very efficient, and we've learned a lot, and it's very scalable. So as Jeff commented before, we can, as we get access to more vaccine, we will continue to enlarge, open up more appointments, and get more throughput to meet that the supply we have.
Is there any concern with congregate settings where people come and go that it will be difficult to vaccinate people with their second doses, that somebody who might be here today won't be here in a few weeks?
No, the critical piece and the safe piece that we needed to really make sure is that we know exactly where everybody is. So if people don't show, we can find them and remind them and bring them back in. And so that there is some ability. You don't have to come back to the exact same location as we go through, but we'll know whether you've gotten your second vaccine and make sure that you have an appointment.
Jim, Marilyn, speak to how we're going to do that here.
Oh, go ahead, Marilyn.
And quickly, thank you. Oh, I love this. Can you come with me at all? We have a plan for that. We discussed that with Dave Santoro, who's been working closely with us. So we understand that will happen, just as we've had people who come in a plan for testing. We, isolate people and then we get them a test. So the same thing, we're going to track new people. It's not like we get hundreds of new people a day, so we'll be able to do it. But absolutely, we have a plan for that. That's not going to follow on on Hartford HealthCare's shoulders, but they're going to be a partner in it, and we know how we're going to do that because we know that's an important piece.
And
Marilyn?
Can I ask you too about signups? You know, equity is a huge deal. I mean, I might be good with a computer, but it's hard to sometimes find access or have a computer. How are, you know, have you seen that in the community that you help serve? And
Well, we're lucky enough that we have what we call our working man center and employment center, 2 great staff, computers which now more socially distanced. A lot of people have handhelds. We work with them on their handhelds. So our staff, we make sure our resources for the men who may fall into that category.
Jim can speak to that globally.
yeah, that would be great. Just a broader sense. I think there's concern.
Absolutely. So we have tried to streamline our self-service for those who can access it through the web or through technology. We've also set up through our access center a call line that you can call 24/7 to ensure that you get allows us to both register and schedule people for vaccines. So that we are making this as easy as possible for people to get there who may have limitations in technology. We have more to do, as Jeff commented. Even that will be insufficient to meet the needs of people in the community. So we are going to need partnerships with trusted community leaders to allow us to continue to listen and figure out how do we reach out and not just wait for people to say, I'm raising my hand, but offer this and make sure that we engage them to come in and get vaccine. It's something, it is really going to be the focus of our work. We know how to do the other part, the people who come through and get vaccinated, and we will make it as easy as possible. This hard work is the piece that we can do, and we are going to prioritize to make sure we do.
Can you talk about the second dose part of this? Dr. Fauci was saying yesterday, because everyone now is aware of the 21 days, the 28 days for the vaccines, but there may be some delay, and Dr. Fauci was saying that if people have to wait a couple more weeks, it's not bad, it's not optimal, but it doesn't mean, I mean, it's not complete. But can you address that? Because getting the second dose could be a challenge for a lot of us.
Yes, and Keith could also speak to this in terms of the detail, but I'll make a go of it. The important part is even the first dose gives you some partial immunity. It's optimal that we get this in a timely way on the second dose. Right now, every single dose we get, the first dose, we're holding the second dose and we have one ready for them. So the only problem with them not getting a second dose is the logistics, and we're taking care of that by making sure we have that follow-up scheduled. So although it's possible that we'll have to adapt, at the moment we've got the first and second dose locked down as very separate things that need to be completed.
And another logistic question. So the feds give the state an amount, you guys get a certain amount of vaccine. Now you can decide what to do with them going along state guidelines, or just kind of wanted the clarification before you decide where to go?
Yeah, it's absolutely the partnership with the state and the clarity they provide of the different eligibility is important for us. As you know, we started with first responders, the healthcare workers, the people caring for the people with COVID. We now have the ability, and very excited about moving into 75-year-olds and more. We've done 6,000 of them since we've gotten the permission to do that, and we will continue to engage those. But it's very important that we follow the guidelines as we move forward, and so that's our approach going forward.
And you'll get an allotment and make a decision as a team to
Correct.
where.
That's right, and what we do is that we have the allotment, we know our schedule, we try and match our schedules to the supply we have. What we don't want to do is have anybody show up and not get a vaccine. It's just not what we do. And to make sure that we're matching that, we have the ability to open up more if we get more vaccine, and plan and ensure that we are matching that supply and demand as best as we can.
Dr. Carden, we've heard some stories about people who are under 75 who've been able to sign up for vaccine appointments. Are you aware of that happening in Hartford HealthCare, and do you have any idea where that might be coming from?
So we know a couple things. One, less than 75 also includes health workers and other people who are still meet the eligibility criteria. So when we look, we can't pull all that apart to see if whether or not. We do know that the percentage of folks of the vaccines we've done that are in that 65, 75, we just wanted to pressure test with that, is less than 5% of all the vaccines that we're giving. So we're pretty confident that if there is any indications, and I can't tell you that it didn't happen, it certainly is not a major part of the issue that we've had. our ability to get a vaccine really does require you to either say I'm a first responder, healthcare worker, or a 75-year-old. Otherwise, we just take your name and your demographics. We keep that information, say we will reach out to you as soon as you're eligible.
And is there any help in Spanish as well? I know that's been
Yes.
a big concern.
Both the digital front door has Spanish and languages. Our call center has hearing impaired, language impaired, a full way for them to access us and communicate effectively.
Thank you.
Dr. Harden, is this mobile unit with Hartford HealthCare just part of a pilot program at Hartford HealthCare, or is it part of the larger statewide vaccine distribution plans to try and get mobile units across the state?
This is really the program we've started at Hartford HealthCare, and the commitment we made, building on our testing capability, which we did the same thing. It's something, as Dave Santoro has been the key behind this. It is a small army of people who have committed to this work, and we're going to continue to move this forward. We need to find any which way we can to get people access to the vaccines as it becomes available.
And from this point forward, are you hoping to grow the program in terms of the number of
Yes.
mobile units that are out in the field at one time?
We will,
Significant.
yeah, we'll continue and this is the beginning, but this is just the beginning of what we're going to be doing.
And just in the short term, the next couple of weeks, where do you have, in addition to Open Hearth, what sort of locations or facilities might you be at in the short term, in the next couple of weeks?
Yes, additional congregate living is really the focus the state wants us to stay on, and that's where we'll be going. That is the priority for us right now.
And is that private congregate living settings or any state-run?
David, I don't know that I know that difference. Shelters and all.
But so not prisons or
Correct.
psychiatric facilities?
Correct. Yes. Sorry, I didn't know that I understood your question.
No worries.
Yes.
With some of the smartest minds here, the double up mask has been a new thing. Can we ever ask, I don't know, does anyone have any information on that? That's been a new topic this morning. Well, we have the smartphone.
You called it. So, there's so much data now we have on mask and the PPE that's available. For example, the mask that Rebecca is wearing, so the normal procedural mask, there's so much data around that. There's no need to double up that mask. It's not going to change the filtration rate per se. It's not going to change what comes in and what goes out. And if anything, it could put some restriction on your actual breathing, right? So that's something you probably don't want to do. Generally, what I will say is, if you wear the mask, a normal mask appropriately, it should be perfectly fine. All right? Any other questions?
What about wearing a surgical over N95?
So actually, OSHA came out with some data. This was very early in November, I think it was, that almost discourages that. So because the N95 within itself, imagine this, in order to wear an N95, our staff has to go through a process. So they have to be clinically cleared, right? And then a fit testing. So in the clinical clearance process, you ensure that there's no chronic lung disease, for example, there's no restriction. And with that, you're putting another device to another level of restriction breathing. So there's debate on that as well. So one of the things if you look at what the procedural mask in the N95 has done, N95 within itself is beyond the requirement of when you look at the size of the droplets of this SARS-CoV-2 and virus. One of the things that I'd like, we actually just spoke about that. How effective has what we've done been? So if you look at where amount of patients Hartford HealthCare had seen last year this time for flu, right? In a bad year, hundreds by this time. Right now, at this point, we've seen one patient. So one patient through Hartford HealthCare with the flu. So how effective has this been? That's data right there. And if you look at countries and subgroups who refuse to wear masks, we have data, right? And if you look at areas with just compliance with basic PPE and wearing the appropriate mask, we have data to show that it's exceptionally effective. Any other questions?
Thank you.
Thank you so much. This is the first step on the next leg of this journey, and it's one we're going to do many, many times over. We can't do enough to get the vaccine to the community, in the community, in partnership with the community. That's our mission. Thank you.
Thanks so much. I know